Hello and welcome back to this channel. Welcome back to this playlist, and we are going to continue this video lecture series on communicable and infectious diseases with one of the common childhood communicable diseases, infectious diseases, which is German measles. So, German measles is an acute contagious disease. It is usually characterized by mild symptoms and a rose-colored macular eruptions or rashes, which sometimes resemble measles and at other times even scarlet fever. And rubella, the other name for German measles, that's Rubella, can affect anyone of any age, not only the children actually. And it's dangerous to pregnant women because it has a teratogenic effect and has a potential effect on the fetus, and it's especially on first trimester. Okay, and rubella as the other name for German measles. So to not to confuse us with rubiola, which is the other name for measles, we take into consideration letter L, double L, German measles, single L, rubiola, um, measles. So rubella or German measles or three-day measles has a causative agent known as rubella virus under the family Toga virus or Toga viridae under the genome or genus Ruby virus. So this is a disease which has different usually manifestations per day, and you can really see the difference or the progress if you try to monitor it. And okay, it is passed through nasopharyngeal secretion, so it's more of actually airborne droplet. Okay, so or droplet, and it is also transplacental in a congenital form. So again, it is very dangerous for pregnant women. So if you are pregnant and you know someone who is suspected of German measles, isolate. Okay, you separate yourselves. This is to protect you and your pregnancy. Okay, and obviously this is an eruptive disease affecting the integumentary system. Then the period of communicability is 1 week before and 4 days after the onset of rashes, and worst when the rash is at its peak. Okay, and infants with congenital rubella may shed virus for months even after birth. In other books, incubation period is 14 to 21 days. Okay, from exposure to the appearance of the rash, and it is communicable and it is contagious. So during the prodromal symptoms, the patient, the infected person can have a low-grade fever, headache, malaise, and mild coryza or runny nose, and also conjunctivitis. Then during the eruptive period, from the word eruptive, rashes, lesions usually appear. Okay, we have its what's this? It's one of its characteristic signs for Shamer's spot, and the rashes appear on this stage, and rash may last from 1 to 5 days and leaves no pigmentation nor discoloration compared to chickenpox, okay, or varicella. In young male adults, there is a possibility of testicular pain, and the for Shamer spot, is usually a petechial lesion on the buccal cavity or on the soft palate. I think I have a picture here I'll be showing later. Again, for the pregnant women, especially on the first trimester, this can lead to congenital rubella syndrome, such as mental retardation, deaf mutism, microcephaly, cataract, and heart disease. Complications to pregnant women, first try usually congenital anomalies, as we have mentioned. Um, Second trimester abortion, and during the third trimester pregnancy, there is a high risk for prematurity of a newborn. So these are the clinical findings. The patient may have fever, rashes with skin redness or inflammation, flaking of the and dry skin, nasal congestion, cough, runny nose or coryza, loss of appetite, arthritis and joint pains, conjunctivitis, um, pain and inflammation of the testes for males, swollen glands, usually in the ears and around the neck. Okay, sore throat, malaise, headache, pinkish rash on soft palate, the four-chamber spot, earache, and lymphadenopathy. Okay, and this is a picture of the four-chamber spots. Okay, the red ones here. And this is on the soft palate. Okay, a baby who is manifesting German measles. Another picture for the oval rose red papules, okay, about the size of pinhead. That's why sometimes called pinpoint rashes. A diagnostic exam actually nowadays is more of a clinical manifestations. Okay, based on the keen observance of the examiner, experience in detecting the disease, they can surely say it's measles. So, what are our assessments? Assess for vital signs, especially temperature. Ask client about the changes in skin color or rashes. Determine whether the client has noted lesions or changes in the skin. Do palpitation with neck to check for any signs of lymph nodes, inflammation, and presence of it. Um, Request for routine laboratory exam. Request for laboratory test. Identify potential sites of infection. Review immunization if it's done. And determine whether client has history of allergies. These are some nursing diagnoses are related to German measles. So preventive treatment, of course, the patient will have measles, mumps, and rubella vaccine or the MMR vaccine. Those who are pregnant should avoid exposure. Okay, so isolate yourself, separate yourselves from people suspected of measles, and prevent the spread of exposure. So since this is a droplet, okay, we apply the respiratory precautionary measures. Okay, keep hands clean and wash hands properly. Cover the nose and mouth while sneezing. Cleanse the toys, the fomites, or things that are usually touched. Affected persons should stay away from school for 7 days, at least 7 days, bed rest until the fever subsides. And for promotive care, when the patient has German measles and you're taking care of him or her, uh, to avoid photophobia, darken the room, maintain good personal hygiene and environmental hygiene, maintain good indoor ventilation, since this is a droplet infection. Then mild liquid diet, but not but nourishing, I should say. Okay, so more of liquid diet, or in general, whatever the child can tolerate. Then care of ears. Do not apply heat or cold unless as ordered. Okay, because of conjunctivitis, irrigate the eyes with warms, normal saline to relieve irritation. But if you don't have just clean water, could do. Then these are the possible complications. One of the most common complication is do we have it here? Okay, so the congenital rubella syndrome for pregnant ones, encephalitis is rare. Otitis media is also rare. Okay, so it's basing from the what's this from the complication itself is really dangerous. Okay, so that ends our video lecture for this topic, German measles, and the following video lecture is measles. So we try to differentiate the two, and it's very important to know the difference between German measles and measles. So see you on the next video lecture. Thank you.